As a cardiac surgeon for over 20 years, I've witnessed something deeply troubling. Every week, I treat seniors whose hearts are failing, not because of what they ate or how much they exercised, but because of a pill they trusted completely. A pill their doctor prescribed. A pill that they have in their medicine cabinet at home. What shocks me most isn't the damage itself. It's that nobody warned them. Not their pharmacist, not their primary care doctor. Sometimes not even the specialist who renewed the prescription year after year. These aren't rare medications or experimental drugs. I'm talking about the painkiller you took this morning for your arthritis, the antacid you swallowed after dinner, the sleeping pill that helps you rest at night, pills that millions of seniors over 60 take every single day without realizing the silent strain they're putting on their hearts. This isn't about creating fear, it's about giving you facts that could save your life. Today, I'm counting down 6 common medications that can quietly damage your heart after age 60. Some will surprise you. Others you may already be taking. If you're over 60 or care for someone who is, stay with me. What you're about to learn could protect your heart and your independence. Let's begin with number 6. A medication most seniors don't even consider dangerous because it's sold over the counter in every pharmacy across America. Anticholinergic drugs, the hidden threat to your aging heart. Diphenhydramine, commonly known as Benadryl, along with medications like doxylamine and certain bladder control drugs. These are anticholinergics, and millions of seniors use them daily for allergies, sleep, or overactive bladder without realizing the cumulative damage they cause. Let me tell you about Margaret, a 68-year-old patient who came to my office complaining of constant fatigue and an irregular heartbeat. She couldn't understand why her heart was suddenly acting up when she'd been healthy for years. During our consultation, I discovered she'd been taking Benadryl every night for sleep for the past 5 years. That seemingly harmless pink pill was slowly affecting her heart rhythm. Here's what most people don't know. Anticholinergic drugs work by blocking acetylcholine, a chemical messenger in your nervous system. In younger bodies, this effect is manageable. But after 60, these medications accumulate in your system differently. Your kidneys process them more slowly. Your brain becomes more sensitive to their effects. And your heart pays the price. These drugs can cause dangerous heart rhythm disturbances, especially when combined with other medications that seniors commonly take. They slow your heart rate, sometimes too much, leading to dizziness, fainting, and an increased risk of falls. Even worse, long-term use has been linked to increased dementia risk and cognitive decline, conditions that further complicate heart health management. The real danger is how common they are. Seniors take them for seasonal allergies without thinking twice. They use them for sleep because they seem safer than prescription pills. But that over-the-counter availability creates a false sense of security. If you're taking any anticholinergic medication regularly, talk to your doctor about alternatives. For allergies, newer antihistamines like loratadine or cetirizine don't cross into the brain and are much safer for your heart. For sleep, addressing the root cause through sleep hygiene or cognitive behavioral therapy works better long-term without the cardiac risks. Because that innocent allergy pill might be quietly disrupting your heart's rhythm. Number 5. Benzodiazepines and sedative hypnotics, the pills that steal your balance and blur your awareness. For years, Robert took lorazepam every night. His doctor prescribed it after his wife passed away, just to help him sleep through the grief. That was 7 years ago. The grief had long since softened, but the pill remained. He'd tried stopping once, but the anxiety and insomnia that followed felt unbearable. So he went back to his nightly routine. Then one Tuesday morning at 3 a.m., he woke up needing the bathroom. Still groggy from the medication, his legs gave out halfway down the hall. The fall fractured his hip and triggered a cascade of complications, including a blood clot that traveled dangerously close to his heart. What started as a sleep aid nearly cost him his life. Benzodiazepines like lorazepam, diazepam, and temazepam, along with sedatives like zolpidem, are prescribed to millions of seniors for anxiety and insomnia. They work by suppressing your central nervous system, which calms racing thoughts and brings on sleep. But that same suppression affects far more than just your mind. Your reflexes slow down. Your muscle coordination weakens. Your blood pressure drops when you stand. For someone over 60, this combination creates a perfect storm for falls, and falls at this age aren't minor accidents. They're life-altering events that frequently lead to hospitalization, immobility, and cardiac stress from extended bed rest. Beyond the immediate fall risk, these medications interfere with your heart's ability to respond to stress. During sleep, if your oxygen levels drop or your heart rate becomes irregular, your sedated nervous system can't react properly. This is particularly dangerous for seniors with undiagnosed sleep apnea, where breathing repeatedly stops throughout the night. The dependency issue compounds everything. Your body adapts, requiring higher doses for the same effect. Stopping abruptly triggers withdrawal that can include dangerous heart rhythm changes and severe anxiety spikes. Cognitive behavioral therapy for insomnia has proven more effective long-term without any cardiac risk. Melatonin, magnesium supplements, or newer sleep medications like trazodone offer safer alternatives worth discussing with your physician. That little pill promising peaceful sleep may be quietly robbing you of the stability you need to stay safe. Number 4. Blood pressure medications. When protection becomes the problem. Here's something that shocks most people. The very drugs designed to save your heart can sometimes endanger it. Not because they're inherently bad, but because aging changes everything about how your body processes them. Consider diuretics, those water pills meant to flush excess fluid and reduce strain on your cardiovascular system. In theory, they're lifesavers. In practice, especially after 65, they can drain your body of crucial electrolytes like potassium and sodium. Low potassium doesn't just make you tired, it destabilizes your heart's electrical system, triggering arrhythmias that can be fatal. Beta blockers present a different challenge. They're meant to slow your heart rate and lower blood pressure. But many seniors end up with heart rates that drop too low, causing extreme fatigue, shortness of breath, and difficulty exercising. For diabetics, there's an added danger. These medications can mask the warning signs of dangerously low blood sugar, leaving you vulnerable to sudden collapse. Then there are ACE inhibitors and calcium channel blockers. Individually, they're often necessary and effective. Combined with 3 or 4 other medications, they create a chemical balancing act. Your aging kidneys struggle to manage. This brings us to the real issue. Most seniors over 70 aren't taking just one heart medication. They're taking 5, 6, sometimes 8 different prescriptions. One doctor prescribes something for blood pressure. Another adds a diuretic. A cardiologist introduces a third medication. Nobody steps back to see the full picture. I had a patient, Eleanor, who arrived at the emergency room barely conscious. Her blood pressure had crashed, her heart rate was dangerously slow, and her potassium levels were critically low. She wasn't having a heart attack. She was drowning in medications that had never been reviewed together. 3 different doctors, each treating one piece of the puzzle, had created a dangerous cocktail. The solution isn't stopping everything. It's having one physician or clinical pharmacist review your complete medication list regularly. Many prescriptions written 5 years ago may no longer be necessary. Doses appropriate at 60 may be excessive at 75. Your heart needs protection, but sometimes less is genuinely more. Number 3. Proton pump inhibitors, the antacid that drains your strength. Walk into any senior living facility and ask residents what medications they take daily. Almost guaranteed, you'll hear omeprazole, pantoprazole, or esomeprazole. These proton pump inhibitors were supposed to be short-term fixes for acid reflux, prescribed for 4 to 8 weeks maximum. Instead, They've become permanent fixtures in medicine cabinets everywhere. The problem unfolds slowly, invisibly. Stomach acid isn't just there to cause heartburn. It serves a critical function, breaking down food so your body can extract magnesium, calcium, iron, and vitamin B12. Suppress that acid for months or years, and those nutrients stop getting absorbed properly. Magnesium deficiency shows up first. Your heart depends on magnesium to maintain steady electrical rhythms. When levels drop, your heartbeat becomes irregular. You might feel palpitations, that uncomfortable flutter in your chest. Some patients describe it as their heart skipping beats. Others feel it racing for no apparent reason. Left unchecked, these rhythm disturbances can progress to dangerous arrhythmias requiring emergency intervention. Calcium absorption suffers next. Weakened bones become prone to fractures, particularly in the hip, which carries devastating consequences for cardiac health. Extended bed rest after hip surgery dramatically increases blood clot risk. Those clots can travel straight to your lungs or heart. Recent research suggests something even more concerning. Long-term PPI users show higher rates of cardiovascular events, possibly because these drugs reduce nitric oxide, a molecule essential for keeping blood vessels flexible. Stiff vessels mean higher blood pressure and increased heart attack risk. I've reviewed cases where patients developed severe magnesium depletion after just 6 months on these medications. Their original reflux symptom, often manageable through diet changes and eating smaller meals, had been masked by a pill that created far worse problems. If you've been taking PPIs beyond a few months, schedule a medication review. Your doctor can check your magnesium and B12 levels, explore underlying causes of your reflux, and discuss whether you still need this drug or if lifestyle modifications might work better. Sometimes the cure creates complications worse than the original complaint. Number 2. Tricyclic antidepressants, the mood medication that disrupts your heart's rhythm. Depression after 60 isn't rare. Loss, chronic pain, isolation, they all take their toll. Treating depression matters enormously because untreated depression itself damages the heart. But the older medications used to treat it, drugs like amitriptyline, nortriptyline, and imipramine, come with a cardiac price tag many doctors overlook. These tricyclics were groundbreaking when they first appeared decades ago. Today, we have safer alternatives, yet prescriptions for these older drugs continue, often for off-label uses like nerve pain or migraines. The rationalization sounds reasonable. It's just a low dose. But even small amounts create serious problems in aging hearts. Your heart operates on electrical signals. Every beat starts with a carefully timed impulse that travels through specialized pathways. Tricyclic antidepressants interfere with these signals, slowing them down in ways that show up clearly on an electrocardiogram. That delayed conduction increases the risk of complete heart block, where signals fail to reach the lower chambers entirely. Your heart simply stops beating effectively. These drugs also cause orthostatic hypotension, that sudden blood pressure drop when you stand up. For someone already taking other medications that lower blood pressure, the combined effect can cause severe dizziness or complete loss of consciousness. Unlike younger patients who might feel lightheaded for a moment, seniors often fall hard, hitting their heads or breaking bones before they can catch themselves. The heart rate changes create additional stress. Some patients develop persistent rapid heartbeat, forcing their already strained cardiac muscle to work overtime. Others experience palpitations that feel terrifying, even when they're not immediately life-threatening. Newer antidepressants like SSRIs and SNRIs carry significantly lower cardiac risk. They're not perfect, but they don't interfere with electrical conduction the way tricyclics do. For nerve pain, gabapentin or duloxetine offer effective relief without the same dangers. If your prescription bottle lists any tricyclic antidepressant and you're over 60, ask your physician directly. Is there a safer option that doesn't affect my heart? Depression and pain deserve treatment, but not at the cost of cardiac stability. Your emotional health and heart health shouldn't be in competition. Number 1. Non-steroidal anti-inflammatory drugs, the pain reliever destroying hearts across America. Ibuprofen, naproxen, diclofenac. If there's one medication on this list you're almost certainly taking or have taken recently, it's this one. These pills sit in purses, glove compartments, kitchen counters. They're trusted, they're convenient, they're everywhere, and that's exactly why they're the most dangerous. The FDA placed black box warnings on these drugs nearly 2 decades ago, not suggestions, warnings. Yet millions of seniors still take them daily, convinced that over-the-counter means safe. Every tablet you swallow forces your kidneys to retain sodium and water. Your blood volume increases. Your heart, already working against stiffer arteries and higher baseline pressure, suddenly faces even more resistance. For younger people, this might cause mild swelling. For someone over 60 with existing heart concerns, it can trigger acute heart failure within days. The mechanism is elegant in its devastation. NSAIDs block enzymes called COX-1 and COX-2, reducing inflammation but simultaneously constricting blood vessels throughout your entire body. Your blood pressure climbs. The protective medications you take for hypertension stop working effectively. You're essentially fighting your own treatment. Studies tracking long-term NSAID users show significantly elevated rates of heart attacks and strokes. Not slight increases, substantial ones. Diclofenac, in particular, carries cardiovascular risks comparable to certain drugs pulled from the market entirely. Yet it remains widely available and widely used. Here's what makes this especially tragic. Alternatives exist. Acetaminophen handles many types of pain without affecting the heart or kidneys. Topical anti-inflammatory creams work directly at the pain site without systemic effects. Physical therapy, heat application, targeted exercises. These approaches don't sell as easily as a pill, but they work without cardiac consequences. If arthritis or chronic pain has you reaching for these medications daily, stop. Schedule an appointment specifically to discuss pain management strategies that won't compromise your heart. Bring your pill bottles. Ask direct questions about risks you're facing. Pain relief matters, but your heart matters more. The most dangerous medication isn't the one with the scariest name. It's the one you trust so completely you never question taking it. Here's what pharmaceutical companies won't tell you, and what many doctors don't have time to explain. Every prescription you take should come with an expiration date, not for the pills, but for the need. Most medications are started during a crisis, after surgery, during acute pain, following a diagnosis. But bodies change, conditions improve. Dosages that made sense at 62 may be excessive at 72. Yet prescriptions get automatically renewed, month after month, year after year, without anyone asking the most important question. Do you still need this? The average American senior takes 4 medications daily. 4. That's not healthcare. That's chemical overload. And every single pill you eliminate under proper medical guidance gives your heart more room to heal, your kidneys less work to do, and your body a better chance to function the way it was designed. Print out your medication list tonight. Tomorrow morning, call your doctor's office and schedule a comprehensive medication review. Not a regular checkup, a dedicated session focused only on what you're taking and why. Bring a family member. Take notes. Ask uncomfortable questions. Your goal isn't to stay on medications. Your goal is to stay alive and independent. Sometimes those goals require opposite approaches. If you found this video helpful, hit that like button and give us your thoughts in the comment section. Subscribe if you want more truth about senior health that protects you, not just prescriptions.